Thank you. All right.
Oh my God, I didn't.
Once again, the 6 steps of establishment of a disease. This is kind of that cycle of infection again. First, we have an encounter, we have the injury, the spread, the multiplication, the damage, the outcome. If you want to take a picture of that quickly. That is the 6 steps of disease establishment. Please know those. Chicken noodle pox. Anyone had chicken pox before?
I got a different variant.
What's the actual term for chicken pox?
Cooties.
That's a long word.
Is that
Varicella. Varicella. Please, by the way, I'll write that down. I've seen that come up. The actual term for chicken pox, which they will not say, is varicella.
Varicella is the bacteria, sir.
Y'all remember, those of you that are around my age, when they used to have chicken pox parties with kids? So growing up, medical science has come a long way, but in my parents' generation, the mindset was, if one kid gets chicken pox, you have a chicken pox party, invite all the kids over, let them all catch it so they have the immunity.
Oh
to
my
it later.
God.
Yeah.
Which is a stupid
Terribly.
thought process when we know about modern
Like
medical science. That
parents,
was the
bro.
mindset in the 80s and the 90s. Yes, you can.
Yeah.
If you've had chicken pox, you have varicella dormant in your body, which can develop into shingles,
And
which is very painful.
Oh, yeah.
varicella is a virus, correct? Varicella is a virus.
It doesn't necessarily be, it's not just elder. I've known people my age that get shingles.
Yeah.
My cousin who's 5 years younger than me had shingles.
I've had shingles.
But do
You
you
got it? It's
When I
painful.
was like
right?
15.
It's painful.
Oh, it's bad.
It goes away though?
It goes
Yeah,
away.
I'm
but
gonna
you're
get it
suffering.
again in my 40s.
So
They
is it
said.
that when people
There
don't
is
have
the
symptoms-
definitions of what we just listed, guys. If you want to take a picture of that, that's the actual explanation. Yeah, here it's just severely painful. You're
2
just,
weeks.
you're in misery.
Suffer for 2 weeks.
I'd say that's someone that's like raking your back with like
But you
nails.
always get shingles when you're 40 and above. How did you get
I'm gonna get it
shingles?
again.
We'll get you.
You also got shingles.
So, my future parents, chickenpox parties are not a good idea. Let that trend die. Yeah.
Dude, if I see you so much.
So, but if you don't have chicken pox, you get shingles later and for 40s. So it's better you have the chicken pox so that you don't get that.
It's better that you never get it at all. You don't
So
want
then
to
you
go
don't build the
somewhere.
immunity if you don't get it.
That's why I said that mindset has changed. We now know that varicella will very commonly develop into shingles, which that's something nobody wants. So ideally, you never want to catch it in the first place. So if you see someone with varicella, you stay away from it. Don't get it. That's an old mindset that we've evolved past now, which a lot of us in here are familiar with.
They don't
Some of us
even have
that are
that stuff
older.
no more.
Huh?
It seems like nowadays they don't even have like chickenpox. You don't
Because they
get it.
quit doing
Yeah.
that spread technique.
Mhm.
The 80s and 90s were chickenpox land,
They
man.
probably have vaccines for it, right? They probably have
Samantha knows what I'm
vaccines for
talking about.
it.
He's
They did, and they also had the thing, they also felt, well, hey, if you get it young, they were also scared if you got it older, you'd have
Yeah.
more scarring from it.
That's true.
Yeah, so, but I'm with you too. I'm upset about it that they did it.
Scratchy usually.
But a just different mindset, I guess.
All right, so outcomes to infection, guys. We have 3 main outcomes that can occur. This is good to know. The host will gain control of the infectious agent and eliminate it. That's the most desirable outcome, that your body's going to get over that sickness quickly. Or the infectious agent overcomes the immunities to cause the disease. That's not desirable. And then, of course, not desirable as well is the host infectious agent compromise and live in a symbiotic state. We don't want any symbiosis going on. Number 1 is the most desirable outcome. 2 and 3 are less desirable when we get infected with a disease.
You said one is more.
1 is the most desirable. We want to eliminate it. Once again, you work pediatrics for 10 years, your body's going to eliminate a lot of stuff. My immune system was a beast back in the day.
Oh,
A beast.
that's why they call you drip.
That's right. And that drip immunity.
Is there a difference between 1 and 2, sir?
Different what?
They're probably isn't it the same thing, 1 and 2?
No.
Host gain the control of the infectious
No, the opposite. They're inverse.
agents.
One's eliminating, one is getting into the disease and having an infection. So 1 is the elimination, 2 is the failure to eliminate. actual disease. There's a good picture if you want it, guys. Just that chain of infection once again, if you're very visual. So I'll take a picture of that. A few more definitions, guys. A host. What's a host for? They provide what we call a favorable environment for infection to occur. We have four main types of pathogens. Do y'all remember off the top of your head the four main pathogens that we talked about a year ago?
Bacteria,
Virus, fungi, and what's the fourth? These are the ones you can actually see with your eyes at one time.
Winery.
No.
Let's do jazz.
Starts with a P.
Protozoas.
Parasite. Parasite. Like a tapeworm. A tapeworm's a parasite. Eat some raw pork and you get tapeworm eggs.
Ooh.
You ever seen a tapeworm get taken out of someone's body?
No.
Pretty scary stuff.
YouTube.
Have you ever
They get
shown
huge.
something like that?
I haven't seen it, but I've seen like videos. I saw a video of a tapeworm that was removed from someone, I think it was in China. He had eaten like raw pork, and they removed the tapeworm. It was like 20 feet long. They just kept pulling it out of his colon. By the way, you know how to get rid of a tapeworm? Like if you ever get a tapeworm, there's a really easy way to get rid of it. So what you do is you're going to fast food for about 7 days.
Oh, Jesus.
You get really hungry, but you're starving the parasites. And that parasite's going to get so hungry, by the 7th day, you just get a piece of meat and you dangle it in front of your mouth and it'll crawl out.
Oh, no.
You lie.
You were silly.
That sounds like some alien stuff,
That
man.
was the first time.
That's a joke my dad used to tell when I was a kid. So I always tell him about this.
Cause I was like 7 days.
That was the
I
first
was like, how are you gonna
Yeah, I'm like,
survive 7 days?
Okay, stay on track. Now I gave you that terrible
Bacteria.
image in your head. Modes of transport, we have two: exogenous, endogenous. Exogenous means outside the body, endogenous means inside the body. Exo versus endo. We have host to host, which is direct, of course, vectors and fomites. We have reservoirs, once again, that's where they grow and multiply, where they thrive. That'd be like our moist areas, our humid areas. This is why we keep the areas as sterile as possible in the hospital to not allow reservoirs to be existent and cause those pathogens to grow. Once again, guys, I hope we know that by now. Big star on it. What's the most important means of preventing disease, no matter what fancy answer they give you? Always hand washing. Keep in mind, hand washing is physical and chemical. It's physical in the actual action. It's chemical by the what? Soap.
Breakdown of the cell.
Soap is a chemical reaction to cause medical asepsis and clean ourselves. Many soaps have our bacteriides, and wash before and after each patient encounter. I do hope we still do this. You probably see some techs do patients and just not wash their hands. That's nasty. Don't do that. Don't be that tech. Don't let me catch you 2 years later when I'm coming to the hospital and I'm watching you do x-rays and you don't wash your hands. Don't roast me out like that.
Iatrogenic.
You taught me what?
People are gonna ask which one is
You taught me what? Not to wash my hands. You told me to not wash my hands?
No, she's saying like.
Who did I see do that? Oh, a lot of techs I used to work with. Oh, there's some nasty people. Especially with your kids. Like, why would you wash everything when you work with kids? Kids are gross. All right, standard precautions. That's our 4 standard precautions that we should all know. Of course, wash hands, wear gloves, wear a mask, and wear a gown as needed. That's our regular standard precautions. We've already went over this. Are y'all okay if I keep going?
Oh, yeah.
Unless you want to take a picture of that, it's just defining airborne versus droplet a little further. Of course, N95 for airborne, surgical mask for droplet.
You definitely
I did. Contacts. That's that team-based approach, by the way. Clean tech versus dirty tech. What are our main sources of infection? These are good to know. Of course, skin, hair. Yes, hair is a mode of transmission. Nasopharynx,
Lice.
who knows? Lice, that's right. You ever get those random lice checks in elementary school? Nowadays, you get an email if anyone has lice. Like I've gotten like 3 emails this year. Like, there may be a suspected lice infection at your school. I'm like, oh boy. Fomites, air, human error, and cross-contamination.
Some bed bugs.
Back up, Mr. W.
Hey, Chuck.
Yeah, I check my kids' hair. Trust me.
That eating a little hair.
You know, you can see lice eggs, right? You know you can see lice eggs if you pull the scalp, expose the scalp.
Doesn't it look like dandruff?
Yeah,
it looks like dandruff.
Okay, good. Last few slides. We're wrapping it up, guys. Okay, so a lot of you asked about the heart stuff. You don't need to know too much about the heart. I've simplified it just as slides I've seen come up in the form of questions. Heart anatomy, not a big deal. If you're struggling with heart anatomy, you're not going to get any questions on heart anatomy until you get to CT and MRI, which is going to ask you way more about the heart than you ever wanted to know. Now, something they will ask is, what is cardiac output determined by? Well, we have two main key factors, that being the heart rates, and specifically the left ventricular output that we call the stroke volume. Please know these are the two main factors for cardiac output. They have asked this before in different formats. Heart rate and what we call the left ventricular output. That's the output found in the left ventricle specifically. Also call that stroke volume.
Okay, so you said the two main things that, sorry.
The two main factors of cardiac output are heart rate and left ventricular output. By the way, left ventricle is where? Right here, guys.
There
The
is
left
a,
side.
Wow.
It's.
I'm sorry.
so on that
That's
side.
left bottom side.
So on
Yeah, I was
that
gonna
side. The left is on that side, sir.
Oh.
This will be the right. No, no.
Oh
This is
my
the left
god.
side.
Anatomical.
Anatomical position.
We not
Yes,
doing
sir.
It's
All right, I'm gonna be very blunt here. If you don't know your rights and lefts by
No,
now,
I
you
know
gotta do
it's
some
sir,
review.
so I don't have any mistake.
I'm saying that very harshly because you will miss a lot of questions if you don't know that. We base everything on what, guys? Anatomical position. So please, 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 I'm saying that very harshly. I'm not trying to be rude, but you will miss a lot of questions if you do not know your left and rights by now. You've got to master that. Whether it's a diagram or an X-ray, it applies to both.
And heart attack is a blood clot, cardiac arrest, heart attack.
Heart attack is a blockage, typically,
Okay.
in the arteries or veins, like usually by plaque. That's what they call plaque.
Is that a blood clot?
It could be a blood clot. Yes. And cardiac arrest is the actual cessation of being you're dead. Your heart's not working anymore. All right, so I put this in here, guys. I know there's a lot more to the heart anatomy than just these four chambers, but this is the extent of heart anatomy you may be asked. But these are pretty common sense. Yes, I think we had this back in grade school. We had this in middle school, high school, and college. Once again, anatomical position, guys. Left atrium, left ventricle, right atrium, right ventricle. Biggest artery is what?
Aorta.
Aorta, that's the master artery coming out of the heart. The main vein is what?
Vena
We have the superior and inferior vena cava, vena cava, however you want to say it. That's what almost killed my wife, by the way. I think I told you that story already.
Yeah.
They ruptured her inferior vena cava in two spots where she almost bled to death.
Oh my God.
Are you in a lawsuit?
Hmm?
Are you saying are you in a lawsuit?
Am I in a lawsuit?
Like, are you suing them?
I got it all taken care of.
Okay.
I'll admit that.
You got big money, just say.
I'll admit that.
No fake like that
Five
man.
pizza.
No fake like that minivan.
Five pizza.
You still on about this
That
pizza thing?
minivan.
Don't worry, there's pizza coming.
Okay, so first we gotta schedule it, and then again.
Today's
You know what I'm gonna start doing? I'm gonna do like my kids and they keep asking me for something. Like, you ask me one more time, I'm not doing it. You ask for pizza one more time, we're never getting pizza. Oh, goodness.
Yeah, we do.
Okay. Was there another question before I go on? Jay?
Do we need to know the valves?
You do not need to know the valves. For CT,
Ejection?
you do.
What about ejection fraction?
No.
Okay.
This will be the furthest they'll go as far as anatomy
extent
for you
of-
guys.
Heart.
If that, I doubt they even go on this. And you'll see some of this really specific stuff like on some of your guides, like in the Mosby or the boot camp. You know, answer the best you can. Don't be like, oh my God, I got all this hard stuff. They're not going to ask you hard stuff, aside from what I'm telling you. Okay, cardiac conduction. That PowerPoint got janky. composed of two principal cell types. We have what's called the working cardiac cells, or the myocardium, and the specialized neural conductive cells. That's the ones that actually give the charge to cause the heart to beat. That's all you gotta know about that. Two types of cells. The working ones, the muscle. Myocardium means muscle. And specialized neural, keyword neural, conductive cells. That's the nerves that are charging the heart via electricity, as electrical output to pump and stay on beat. That's what doesn't work for my wife, by the way. Her nodes don't work correctly, which is why she has the device.
It's you said it was the SA? Her SA or both A,
Both.
AB? Wow.
Oh, wow. Do they say like eventually she'll need like a water
This
transfusion?
is-
They feel confident that her device will keep her up and running for her whole life.
So do we have to know the labeling of this? The
Did I say you need to?
Sorry, sir.
Did I say you need to know it? What did I say you need to know on this slide? I just want to make sure we're paying attention. What did I say we need to know?
That,
These two things right here. Don't worry about the nodes, just know you have two types of cells. That's it. Keep it as simple as possible. I don't want you to overthink it. Overthinking is a danger. All right, I'm gonna skip that because you do not need to know those. Now you do need to know the different types of arrhythmias. This is a great one to take a picture of. Good simple definitions. Bradycardia, we see brady, that means slow. Slow heart, bradycardia. Tachycardia, opposite, it's fast. Fast heart. Fibrillation, it's when the heart actually quivers or is irregular. Keep that in mind, does not mean simply quivering, it can be an irregular heartbeat as well. That's called fibrillation. PVC is a flutter out of rhythm, so if your heart's beating and also it like skips a beat, as we call it PVC or a flutter. Ventricular tachycardia, well, that's something we used before, so it means what? Something fast. It's fast improper electrical activity in the ventricles, specifically. Ventricular tachycardia, it's in the name. Ventricular tachycardia. Fast heart ventricles. Break those words down. On the same token, ventricular fibrillation. We saw fibrillation, that's that quivering, rapid erratic beat. Rapid erratic quivering in the ventricles. Asystole, that's another way of saying what? Death. Heart stopping. Asystole, total cessation of electrical activity. There's no electrical activity, there's no heartbeat.
Nice.
Thus we are dead as a doornail. Dead as a doornail. That's what my grandpa used to say. That thing is dead as a doornail. I don't know what that means, but
Ain't moving.
dead doornail's not even alive. So get this
Flatline.
point.
Yeah.
Dead as a
Yeah,
doornail.
that's a
And it's already
Yes,
flat.
that is
It's a
door-
flat line.
Yeah, it's flat.
line. So you just said it.
Yeah.
All right.
Alright, enough.
I've had enough. You've had enough.